Femi Doyle-Marshall.
Happiness, and I know everything that shine ain't always gonna be gold. Hey, I'll be fine once I get it. I'll be good. I'm on the pursuit of happiness, and I know everything that shine ain't always gonna be gold. Hey,
This is The Pursuit of Fitness with Femi Doyle-Marshall.
The value of health and fitness plays an important role in the global context. Focusing in on the local arena, the minister, Margarett, sits down with me to discuss a few of her ministry's objectives, the headlining mission of her team with regards to promotion, and how she gets down when it comes to training. It's wise to find ways to take charge when it comes to your health. Look into the various tools that are accessible in your area for you and those around you. Be above the norm. Do something. I am very grateful to have the opportunity to sit here with the Minister of Health Promotion
And sport.
We gotta have all the information in today. Now, once again, I would like to thank you for coming out. How are you feeling today?
I'm feeling pretty good, and thank you for coming down to meet with me. Yeah.
It's not a problem. So we're gonna get really focused, thinking of fitness, but not just fitness, health promotion, and how that can be involved in the community. But I want to find out a little bit more info about the Ministry of Health Promotion. How is this ministry different from the others?
Well, there are various different ministries in government. I guess the closest related ministry would be health and long-term care. This ministry is really about health promotion, and it's about prevention. Our focus is on influencing people's behavior and trying to get people to think more in terms of health first, and to promote physical activity and healthy eating. We're also focused on raising awareness about how important it is to put health first.
So health is one of the key things.
Well, it's health and wellness in terms of from the promotion and prevention perspective. That's what is key in this ministry, prevention. Yeah.
Okay. So you do support healthy initiatives then?
We support a variety of different initiatives in this ministry. We focus on chronic disease prevention. Part of that is our smoke-free Ontario strategy to prevent people from starting to smoke and to help people to quit smoking. And our government has invested significant sums of money in that smoke-free Ontario strategy as well.
Besides smoking, are there any other key initiatives that's really been pushing at the moment, or?
We have our after-school program in the ministry as well, which is a program that we introduced a couple of years ago, and it is designed to address issues relating to obesity, non-smoking, various different issues, self-esteem issues, different issues, overall wellness for people in grades 1 to grade 12 in a key time period, which is the time period between 3:30 and 6 o'clock, when kids are usually at home alone, usually unsupervised, in front of the TV, using the different electronic devices. And we had a report from former Chief Justice Roy McMurtry and former Speaker of the House, Dr. Alvin Curling, related to the root causes of violence, and they had recommended that we need to have programs where we are targeting that particular time period of day to engage young people, and so we came out with a program. We created a program to address some of those issues.
So these same programs, you'll find them in majority of, I guess, post-secondary or more secondary schools, or all?
Well, it's like I said, the age group is grade 1 to 12, so that is right from elementary up to high school students, and we're trying to target, because we believe that we have to develop culture of young people who think in terms of health first, and so we target those young people, and that is a key time period that has been identified by various different experts, and I mentioned some of them, and also Dr. Pascal, who is an expert at early childhood education as well, as a key time period to engage kids, and we want to engage them in various activities at that age, and also to keep them off the street, to keep them busy, and so we've rolled the program out in several communities across the province, and targeted some of the priority areas, because that's where we find that there are a lot of children who need to be engaged.
The same program that you're talking about, I'm going to shift gears, and maybe we can combine these together. The Healthy Communities Fund.
That's a different program.
That's a different program. I want you to talk a little bit about the Healthy Communities Fund.
Yeah, well, the Healthy Communities Fund is another program that we rolled out in various communities across the province as well. We felt that it was important to engage organizations and in communities working together to create programming that are and initiatives that are good for the communities and that are going to engage various different people in the communities in various different activities, certainly to do with health and wellness from the perspective of physical activity, healthy eating, non-smoking, cultural, to recognize the cultural diversity that exists in the various communities that we have across the province. And so in that respect, in that regard, we rolled out the Healthy Communities Fund as well, and we targeted like organizations in work to get them to collaborate, to working together, because what we've found is that there are often different organizations doing similar things in communities, and we want to see more organizations working together so that they can build on the best practices that exist in each individual organization, so that they can use those best practices to more effectively address the issues that are arising in communities, and so we can build better community health.
Would you be able to list some of the more recent programs that the Ministry of Health Promotion has been able to fund through this?
Well, there are. I will. You will have to go to the people who are in my ministry, and they can give you a whole list of those programs.
But there's a lot.
We have lots of Healthy Communities funds programs throughout various different communities in the province.
How important is physical activity to Ontarians?
Physical activity is key, to healthy living, and it's not just to Ontarians; it's to everyone, everywhere. Certainly, we're in Ontario, and our focus here is Ontarians, and our government certainly is very cognizant about the importance that physical activity plays in the lives of the people of Ontario, and so. Part of the work we do is engaging individuals in various different initiatives that will also help to keep them active. But we also, this ministry funds the provincial sporting organization and the multi-sporting organizations as well. And part of that is to engage kids in physical activities in schools, and so certainly, throughout the school systems, and it's very important to also get them engaged that way as well.
How physically active are you?
I think I'm pretty physically active. I'm very a busy person, and so I have to certainly make time for physical activity, and I am very cognizant about how important my health is, and I certainly believe that as the Minister of Health Promotion and Sport, I have a duty, if not an obligation, to lead by example. And so I have to certainly be an example when I walk out the door to Ontarians as a person who looks at least the part of, the Minister of Health Promotion. And so I try to walk as much as I can. And walking is great exercise, and it doesn't cost anything for those who are able, because we recognize that there are individuals who are living with various disabilities who may not be able to go for a walk, and the things that some people take for granted, which is so great for our health. But I do try to do that when I can. But I also, I'm engaged. Otherwise, I have an elliptical at home that I do work out on it when I get up out of my bed and before I go to sleep many nights. And I also have one of those big balls, the exercise balls at home too, which I use as well. And I have my weights and other things. So I do exercise almost every day.
I like the fitness conscience we're getting right here. People might not know this. We're getting information about how the minister trains throughout the week. So that's a little plug for everyone out there wanting to get fit and get healthy. People don't know. I'm actually right now in your office, and I just checked out your heavy bag.
Yes, I do have my heavy bag, as you call it, in my office, and I use it every so often. Like when I'm going off to the legislature, I'll run over to the bag for a few minutes and punch it a few times, and then head over to the ledge. And so this is a really good piece of equipment to have in the office. It's good for the arms, And I do have people who say to me all the time, my friends, they say to me, "You have great arms."
Watch out, people. Watch out.
Watch out, Michelle Obama.
There we go. So we're doing little plugs here at the same time.